Joining us right now in studio are board-certified physician Dr. Vim Patel and introspective counselor Chitra Prasad Patel from Evolve Personal Health here in South Tampa, Florida, a brand new facility that is taking concierge medicine to a whole new level. Thanks for being here.
Thank you.
Thank you guys for having us.
You're welcome.
We actually got to visit these guys a couple of weeks ago, and we thought, you know what, come in and do radio, too. We had you for a TV show.
Yes.
But interesting to note, before you started Evolve, Dr. Patel, tell us a little bit about your previous life working at a hospital and kind of what made you want to branch off and do your own thing.
Right. I was a hospitalist for about a dozen years, and within that time span, there's high acuity in the hospitals, as you know. If anybody's ever been admitted into a hospital, you're normally pretty sick if you need to be there. And looking at the stream of patients that came in, I realized there was simply Band-Aid medicine being performed. Now, I don't mean to criticize the entirety of medicine. I love it. I'm a part of it. And it was just something that I felt needed to be corrected. So we went out, and I left that acute care practice to start a more patient-centered, patient-focused practice where we can kind of take the ailments not simply as a prescription-based form of medicine where we give medication, but where we try to change mindset and where we try to change behaviors.
Mm-hmm.
So why do you think, though, that there's so much doctor burnout?
I can give you a myriad of reasons. I'm sure Dr. Bonatti can chime in with me, but it is the state of medicine today. Unfortunately, maybe we can discuss that at some later point.
Sure.
But there are constrictions going on with the state of healthcare that physicians do feel. There are time constraints. There are constraints upon patients as well. So we decided to kind of move our practice outside of those constraints and kind of give patients the freedom to maneuver and the guidance to move along in their health journey.
You know, it was such a different experience being at Evolve. It was just the feeling from the time that you walk through the door.
It doesn't feel clinical. You know,
Not
it doesn't
at
feel
all.
like you're visiting a doctor, and that was by design, right?
Right, absolutely. So we put conscious thought into even designing our physical space where we wanted, like you guys said, when you step in to get a sense of calm, we designed our protocols around, patients and their time and what they would want. So it was a conscious effort to go in and say, what would I want from a doctor's office as a patient? And that's how we kind of came up with Evolve Personal Health.
Why don't you describe what you call Vimchi?
So Vimchi is a proprietary methodology that we created. It's a play on names. It's a play on the words. My name is Vim. My wife's name is Chitra, so Vimchi. It also means Vim is the physical force and Chi is that life force, that metaphysical. The combination of the two we find really helps patients. So when in my prior manifestation, I was a medical doctor where I'm treating you based on your lab numbers and what you're complaining about, and there'd be almost a prescription or two handed out after the fact. So now what we try to do is take a look at it from different viewpoints and to say, is there a way we can kind of alleviate these ailments or these problems in these patients without medication, with other modalities such as yoga, such as talk therapy, and that's how we kind of created it, where we wanted to change the paradigm of medicine.
It was kind of interesting. We'll talk to you here for a second, Chitra. What I got to do with you, like you say, it's the introspective counseling. Tell us a little bit about that. It was almost like a therapy session, if you will.
It is kind of like a therapy session. I think that one of the things that was missing from what Vim was talking about whenever he would come home as a hospitalist was that introspective part. There wasn't enough opportunity to really find out why something is happening or how the patient feels about it, or to talk about their stress or anxiety level. And so what we did was combine what we both did. Him as a doctor, and I have been meditating for about 20 years, and I'm a life coach and executive coach. And so to combine those to talk not just about the physical symptoms that someone's dealing with, but everything else that's going on internally.
Do you feel that there's better outcomes for your patients because of that?
Absolutely.
I think that the feedback that we're getting is that this is such an important part that they actually don't have this in life.
Correct.
When I think that we usually think that it's therapy or counseling, but life coaching is a very quick-based movement.
Solutions-based.
Yeah, so it's, talking about something, looking at your current resources and seeing how you can move forward with it.
What I liked is when we saw the patients come in, it was like they were seeing family. When they came in, they were getting help with nutrition. They were talking to you about whatever they needed medically. They were getting the counseling, the introspective counseling from you. Why don't you talk about how you kind of develop that community and things you do, because you're kind of hanging out with your patients.
We're definitely hanging out with our patients. They take off their shoes.
Right.
They come put their stuff on the couches. It's very much about that personal relationship, and that's really what coaching is.
Right. We have a very serene environment, and one of our patients said the other day, "This is where I come to laugh." So, I mean, that's terrific for us to hear that. So, what we wanted to do is create a sense of community, security, where it's not just the benefit of having your doctor's phone number on your phone, but it's also the comfort of a friend that you can bounce some questions off of, right? So we have a comfort level, like a family type environment, as you described, for our patients, for our greater community. So within that office, we kind of translated these same sort of philosophies, and we kind of put them into our patient care.
Yeah, it was a very cool experience. If people want to learn more about Evolve, how do they get in touch with you guys?
Our website, evolvepersonalhealth.com, and then we are on Facebook, Twitter, Instagram.
Everywhere.
Yes.
All right.
Well, thank you very much for joining us in studio. Thank you.
Thank you, guys.
Thanks so
Thank
much,
you very
guys.
much.
And again, look for these guys on an upcoming episode
Yes.
of the TV version of American
And
Medicine
that one
Today.
was fun because we got to put on our best yoga
Put on our
outfits
gym
and-
outfits and do some
check out
stretching.
our balance and stretch.
And
And
Dr.
work on
Patel,
our Vim Chi.
And Dr. Patel said that I had horrible balance, which I'm still kind of seething about because I thought I had good balance.
Because I know you're a jiu-jitsu master.
Yes.
You see Ethan
Jiu-jitsu
try to hold his
master.
pose.
Yeah.
Well,
I've evolved to becoming a master. Like that segue?
personal growth. Yes, right here on American Medicine
Ethan's
Today.
experienced it with one visit to Evolve.
That's right.
Make sure you stay tuned.
You're listening to American Medicine Today, presented by the Bonati Spine.